Healthcare professionals, you're in trouble. Statistics show that you are on the fast track to burnout. Canadian emergency rooms are overfilled, and there are less primary doctors to alleviate that strain. My name is Jody Hardy, and I specialize in stress and overwhelm and trauma after diagnosis. When I was in the hospital, I was on the amputee ward, and I saw just how much lack of knowledge that they had about their own bodies. They would lash out at their physiotherapists, they would lash out at the nurses, and they didn't know how to move their bodies the way that they needed to in order to get up. 98% of changes fail when a person is suddenly faced with changes. And that's what I want to change. What I've seen is that clients that are in front of you, they hear you and they agree with everything that you're saying, and they want to do the very best that they can. However, when they get home, they look at that list that they were given and they start thinking, how am I going to change my life like this? How is my spouse going to react to these changes? And they fail before they even start trying. Patients need support outside that doctor's office just to keep them on track, to keep them on the straight and narrow. It's not the doctors or the counselors or any other health professional's fault. You're giving all the information that you possibly can to help your patient. It's just the part at home. When patients have the right support, their success rate goes from 2% to 85%. When I step in to help with creating these changes, I actually start formulating a plan of how everything is going to relate to their life. So at home, at work, special occasions, parties, kids, spouse, and I integrate a program that they can use no matter where they are in life. And we come up with action steps that they themselves are able to figure it out with guided questions, with guided support. And we think about the obstacles coming up and we problem solve those together so that they no longer are problems. Health coaching can look like many different things to a lot of different people. For me, I like to be hands-on. I'll go grocery shopping with them to help them learn how to read labels. I will actually go and declutter their kitchen and their pantry. If you have the right support at home and the right setup, you're more likely to succeed. Patients keep ending up in the ER because they haven't been able to learn to keep those changes in their lives. They keep reverting back to old patterns. Doctors, I want you to experience more patient compliance. I want you to succeed. I want to stop the vicious cycle, freeing up you to do more of the things that you enjoy in life. In February 3rd, 2018, I was driving to Fort McMurray to see my husband. And I had our beautiful little girl in the back seat, and somebody, for whatever reason, decided to cross the center lane at highway speeds and hit us head on. Marley died instantly, and they tried to keep me in a medical coma. I was able to rest and stay under until all my surgeries were completed. I've had metal rods placed in all of my long bones. My right leg was viewed as a complete shatter from the ankle right up to the hip. I was supposed to be in trauma for 3 months because I could not weight bear. But because I knew how important it was to keep the body moving, I started transferring 1 week after the accident. Every day I did the work. I was doing homework from physio during the rest of my workday at the hospital. I lived with family for 3 months after that until I could actually live on my own. I'm not gonna be somebody who needs a cane. I'm not gonna be somebody who needs a walker. Recovery is a full-time job, but I will be the active mom that my 2 surviving kids deserve. My experience benefits clients that I work with because I know what it's like to feel like there's no hope. Understanding that helps me have more empathy, but it also strengthens me to hold people accountable. So when a patient comes to us after a doctor recommends us, we have systems in place that help you address all different quadrants of your life. So family, friends, work, home, extracurricular. First of all, you want to look at what their home life is like and how you can de-stress that, because if you can de-stress that, a lot of the overwhelm goes away. Then we look at what their nourishment is like and whether that needs improvement, and that is the process that we take them through step by step by step, gradually. And then we look at what work is like and if that's really stressful, and how just making little small changes at work can help decrease stress and overwhelm as well. Because when you're in a relaxed state, you make better choices for yourself. We also look at relationships, because we all know that if our relationships are not taken care of, we feel very stressed and very disconnected, and to make more changes is not going to happen. So we really break down those relationships on how to make them better, and how to have individual relationships with the people in your family, and what's so important is an individual relationship with yourself. Changes can start today. Please visit elementsofwellness.org. There you can email me directly, or you can book a call to coaching. What do you have to lose?